I'm Elizabeth Swider, founder of Care is There Geriatric Care Management. And this is a presentation about how to create your own plan for extended care, whether you're planning for yourself or for a loved one. This topic is central to our work at Care is There. We are geriatric care managers, or as we also like to call ourselves, lifestyle coordinators, because our work is about helping our clients and their families have lives they love, whatever it is that they choose. We work with busy or long distance caregivers who want to be sure their loved ones have the access to all the resources that will make their life great, and with older adults who want the best life possible for themselves. We work with people who live in their own homes, independent living communities, assisted living, memory care, and nursing facilities. We provide active care management and lifestyle coordination, which involves doing evaluations in over 20 areas of life to identify areas where improvements can be made, recommending best practice solutions, and implementing the plan. And then we're in close, ongoing contact with our clients to monitor their situations and respond to changes. We do what a family member would do if they lived next door, didn't have any other responsibilities, and had access to a huge knowledge base about solutions and resources. We also have a just-in-case program for folks that want to have resources in place if a need arises. And we have a daily money management service where we help people pay their bills, get their tax documents together, file their long-term care insurance claims, or as one of our clients used to say, win the paperwork war. In this presentation, we'll talk about what you can expect about the care you may need in the future and what to think about as you plan. You can download a free do-it-yourself format for your plan on our website in the resources section under Support and Joy, then Care Coordination, in the article called Create Your Plan for Extended Care. This is a scaled-down version of the planning we do for our clients. If you need help creating or implementing the plan, you can always call us for a free consultation. So how much care can you expect to need? Everyone is different, of course, but the U.S. government research says that a person turning 65 today has an almost 70% chance of needing some type of long-term care services in their remaining years. 65% use 2 years of care at home, and 37% use 1 year of care in a facility. And we all know lots of people who have needed far more care for a far longer period of time. How to plan for extended care. Here are some things to think about when you're planning for yourself or for someone that you love. First, have the courage to be realistic. Most people just hope they won't need care. And when the time comes and they do need it, it's a scramble and they may not get the care that they really want. So the first step is to be courageous enough to admit that we and our loved ones will probably be part of that 69% that needs care. Then educate yourself about your options and the cost of the options so you'll know your choices and how to plan for them. Then do some introspection to determine what makes you happy. If you're a social person, consider that when deciding to live with loved ones who work all day. If you love your solitude, create in your plan a way to have privacy. If you love your pets, be sure your pets are welcome where you plan to be. Consider the impact on others. You may feel confident that you're fine, but what happens if you do have an injury or another acute health problem? Can you handle it on your own? Do you care for someone who will be in jeopardy if you're hurt? The people in your life will worry about you. And they also have to be concerned about the impact on their life and the people who depend on them if you have an emergency and they have to drop everything to deal with it. So write down your plan and share it with the people who are concerned about you. That will ease your mind and their mind, and it might just keep them off your back if they're pressuring you to make changes you're not ready for. Then make the legal and financial arrangements necessary to make your plan work. What to plan for? Here are some categories to think about. Prevention is always the best medicine, yes? It's usually an injury like a fall or a chronic illness that causes the need for extended care. So make a plan for how to make your home safe so you won't fall, and how to keep your chronic illness in check the best you can. Think about aspects of daily life that wouldn't get done if you can't drive, or your eyes won't let you read anymore, or you can't hear well on the telephone, or you're starting to have trouble with your memory. Or if you lost your spouse who has always taken on certain responsibilities. Who will make sure your bills get paid? Who will remind you of your appointments, keep your hearing aids working, all the rest of it? And think about what you would need to do for personal care like dressing or bathing. If you had a stroke or were recovering from a bad fall or hip surgery and couldn't do it yourself. What would you do if you had a medical emergency? Who would be with you in the emergency room to tell the emergency room staff what you want and don't want and what medications you're taking? Who will plan your discharge if you're in the hospital? Who will help you find a new place to live if you have to move? And what if you need full-time care? How will you manage that? Will you move to a senior living community, move in with relatives, have care at home? What will it cost and how will you pay for it? And what about your own personal fulfillment? Health and safety only take us so far. How will you make sure you're able to see the people, participate in the activities, and live in an environment that brings you joy? Each of these categories should be in your plan, and they're addressed in the care plan format that I've made for you. So who will help? Who will give this care that you're planning for? You can rely on your family and friends and neighbors and your religious or civic communities. You can rely on them sometimes. We'll talk about them next. But if they're in your plan, discuss that with them so they know what you expect and you can think through the whole situation together, because there are some pitfalls. And you can hire a variety of professionals. You can choose to move to a senior living community. You can hire a home care agency, a gardener, a handyman, daily money manager. But whether your friends and family help you, or especially if you hire professional resources, someone needs to be the manager. And it doesn't work for the manager to be you. I think that's a common fallacy, the belief that we will hire people to take care of us and we will be their manager. But if you have memory loss, a chronic disease that keeps you from easily moving about, communicating on the telephone, getting online to do research, communicating, you probably aren't an effective manager of your own situation. Maybe at first, but as things get really hard, you need someone advocating on your behalf. We do that professionally for our clients at Cares There, but family members or friends can do it too. Just be sure they're reliable, trustworthy, available, and willing. What will it cost to have care provided by your family or friends? We kind of tend to assume that if our family provides care, it's free. For many people, caregiving is an extremely fulfilling experience and something they would never have otherwise. But we should be real that it costs time and energy. People quit their jobs and curtail their careers to care for someone they love. They could lose their health insurance in the process and compromise their own health care. I know people who have lost their marriage when a loved one moved into their home for care. The stress of caregiving can sometimes damage the relationship between the caregiver and the care receiver. Many people hire us at Cares There just for that reason. They want a great relationship with their family members in the time that's left. And being in a care receiver-caregiver relationship can sometimes strain that relationship. Same thing with siblings. Usually one sibling does most of the caregiving and maybe they feel resentful, and then the other siblings have their side of the story and arguments break out. One of our clients has said many times that having Cares There as their care managers saved their relationship with their sibling. The caregiver may need to give up time with their own children to do the caregiving, and they may have to sacrifice other things that are meaningful in their life. All this adds up to stress and health problems, which is now so common it has a name: caregiver syndrome. Studies suggest that many times the caregiver dies before the care receiver. This is the way one study put it. Clinical observation and early empirical research showed that assuming a caregiving role can be stressful and burdensome. Caregiving has all the features of a chronic stress experience. It creates physical and psychological strain over extended periods of time, is accompanied by high levels of unpredictability and uncontrollability, has the capacity to create secondary stress in multiple life domains such as work and family relationships, and frequently requires high levels of vigilance. Caregiving fits the formula for chronic stress so well that it is used as a model for studying the health effects of chronic stress. So, this isn't to say that you shouldn't care for your loved ones or agree to be cared for by family and friends. It just means to go in with your eyes open, to make a plan knowing the risks and costs so you can manage them. And if you are the care receiver, it goes a very long way if you're gracious to those who care for you, if you're flexible about the circumstances, and that you take responsibility for your own happiness. Look for ways to contribute to your caregivers before you need care and while you're being cared for. If you hope your faith community will help you or will help look after you when you need it, look after them now. If you can look after the grandkids when they get home from school now, build a relationship with them, it paves the way for them to help you later. What will it cost to hire professional care? Genworth does a great study every year that gives the costs nationally, by state, and by certain cities. These are the national median costs for 2017, but to get updated costs or to get the cost for your area, go to the link on this page. Notice the cost of a home health aide for 24 hours per day care, 24/7 care. This is not a number that Genworth gives. I actually created this number by taking Genworth's 44-hour-a-week rate and converting that to 24/7. But I want you to just take in the magnitude of that number. I think a lot of people plan to stay home till the end of their life and hire in care when they need care at home. If that's your plan, just be realistic that when it gets to the point of having 24/7 care, it becomes extremely expensive, far, far more expensive than living in a facility. So take that into account with your plan. Also, notice that adult daycare is one of the most affordable options on this list. It's also one of the most underutilized options. And you can combine adult daycare with home care in the evening to make kind of a 24-hour option. Something not included on this list is the PACE program, which is available in some areas. It's a program for all-inclusive care for the elderly, where clients can go during the day and then they can come home at night. But the PACE program also includes health care in their facility. So how will you pay for professional care? It's important to understand that Medicare does not pay for long-term care. It only pays for short-term, mostly medical care. Health insurance only pays for medical expenses, not living expenses. Medicaid is only for the very poor, and it means you must go where there is a bed. Also, assisted living availability is very limited. Long-term care insurance is designed exactly for this need, to pay for long-term care costs. So it's something very important to consider in your plan. There is some financial assistance for veterans, but you should work with your financial advisor to look at all your resources, everything that you qualify for, everything you have available to you, and come up with your own financial plan to fund your long-term care. So as I said before, at CARES we do an in-depth evaluation process with each of our clients in many areas of life, but I wanted to offer you a do-it-yourself version to get you started. This is a scaled-down version of what we do in a very simple format, and as I said, it's on our website. You can download it in our resources section at the link provided there. This chart shows the format for the document. The document lists many different areas of life, what care you may need in that area, and suggestions about personal and professional resources who can provide the care. Then there are columns for you to fill in what it will cost based on what you choose and how you can pay for it based on discussions with your financial planner. So I hope this has been helpful in getting you started. Again, if you want our help at Care is There to create or implement your plan, see us for a free consultation. You can also use our Just In Case service to make us part of your plan for extended care if you need it, or you can engage us now as your active care managers or daily money managers. This is our contact information. Please contact us if we can help you or anyone you love. You can download these presentation materials and other materials in the resources section of our website at careisthere.com. I'm Elizabeth Swider, founder of Care is There Geriatric Care Management, where our vision is that all older adults and their loved ones have the knowledge and local support to choose and implement a life they love.